Good afternoon, everyone. Thank you for joining the webinar this afternoon about the real-world outcomes across the AD spectrum, or Roads to Better Care. I'm pleased to be here presenting on behalf of the co-leads. So we have Frederick from Novartis on the phone today, and as well we have Biogen, which is also one of the co-leaders. And the consortium right now includes several pharmaceutical companies and biotechnology companies, including Roche, GE, Janssen, Pfizer, and MSD. I'll give you a little bit of background about where this project came from and the idea of it. As a pharmaceutical company, Eli Lilly and Company, as well as Novartis and the others that are part of this consortium, are investing a lot in Alzheimer's disease treatments and different diagnostic tools to help advance treatment in this disease state. And what we've learned over probably the last decade or so is that, in fact, the disease starts probably 10 to 20 years before we actually see clinical symptoms. So although much of the focus currently in the healthcare system is on the end state of the disease or in the dementia stage of the disease, we know that it starts much earlier, and therefore a lot of the focus on these new treatments and diagnostics is actually before we see the symptoms. So in preclinical Alzheimer's disease as well as prodromal. And there are lots of efforts right now to make sure that drug development is accelerated across the spectrum of the disease, so starting in preclinical all the way through the dementia and end stages of the disease. But we also know that the current data sets and the current care systems don't really address the full spectrum of the disorder. And certainly there aren't any really good ways of being able to understand and characterize the full spectrum of the disease in the current data sets that are available. And the other piece of this is we want to make sure that as these new treatments become available, that we have the data sets we need in order to get access and reimbursement to ensure that the patients who are going to benefit from these new treatments can actually get them in a timely way. We're conceptualizing this project in 2 stages. What we'll talk about today is actually stage 1 of the ROADS project. And we believe this first phase is an important initial step in building AD-relevant real-world data sets that can answer questions about the natural history of the disease, cost-effectiveness of new interventions or treatments, pharmaceutical or otherwise, and also the clinical utility of any new diagnostic tools or new pharmaceutical treatment interventions that would target the entire spectrum of the disease. So again, the focus here is really to enable a data system, a data architecture that will allow us to understand the full spectrum of the disease. If you go to the next slide, please. So the objective of the Roads to Better Care Consortium, again, I mentioned that we have a very nice group of different pharmaceutical and diagnostic companies that are participating. What we'd like to do is to define a minimum set of measurable patient-relevant real-world outcomes. And the idea of doing this as part of a consortium is that we'd like these outcomes to be aligned with all different key stakeholders and make sure that they're fit for purpose across these different key stakeholders. So for example, not just in academic research, but that they're relevant to regulators, to health technology assessment organizations, any sort of relative effectiveness assessment that might need to be done, again, post-launch for some of these new treatments, and also that it's a set of outcomes that could be understood and interpreted within the context of clinical guidelines and optimizing current healthcare systems, again, recognizing that current care for Alzheimer's disease patients and for dementia in general is fairly fragmented and includes both social and healthcare systems. We'd like to work in collaboration with national health authorities, health technology assessment bodies, as well as regulatory agencies to develop a set of recommendations on these AD-related cognitive, functional, and behavioral endpoints that we believe could be used across a variety of different types of research programs, again, focusing on real-world applications and data systems outside of clinical trials. If you go to the next slide, please. As part of this first stage of the ROADS project, we would then be working as part of this consortium to identify data sources, outline a data strategy, and so that may include aggregating across different types of data sets and identifying gaps in current data sets. And we'd like to identify all of these sources in order to characterize the spectrum of Alzheimer's disease across disease stages, again, from preclinical all the way through dementia, and across multiple geographies. So the interest here is not just in country-specific outcomes, but in outcomes that we feel like can be generalized across different geographies, multiple countries. And we'd also like to identify best practices in collecting real-world clinical outcomes in patients with Alzheimer's. We anticipate that part of this first phase of ROADS can also identify new methods and technologies that could be incorporated into clinical and social care practice, and that these different methods and technologies could help facilitate collection of patient and caregiver-centered outcomes. The other objective is to provide recommendations of these different approaches to model disease progression, and that would depend on the data sources that are available, but also potential new data sources or new ways of combining data that would enable a better treatment selection and improved healthcare value for Alzheimer's disease across the spectrum. So if you go to the next stage, or next slide, please. We believe, given the gaps and given where we are in development, that this type of project is best suited to a pre-competitive collaboration. These are the issues and concerns that are facing those of us not just in the pharmaceutical industry, but in the diagnostic industry. We believe in the healthcare industry more generally, but given the potential impact of Alzheimer's disease on society more generally, we believe that this is relevant across a variety of stakeholders. So this is really ideally suited for the IMI framework because it allows those of us with expertise in drug development across the spectrum of the disease to collaborate with other experts both in the disease state but also in the methodologies of collecting data, and also people that are making decisions about how best to treat patients with Alzheimer's disease, and also how to enable health and social care systems to reimburse for appropriate treatments, and really prepare the social and healthcare system and data system for all of these new treatments that we hope will be emerging in the next 5 to 10 years that address the increasing societal burden of Alzheimer's disease. So again, we don't believe that this type of work can be done alone by any one company or alone by any one academic organization or even any single government. We really believe that this is something that needs to happen across the European community at large. And so with that, I'm going to turn it over to my colleague Frederick from Novartis, who will take you through some additional details about our project proposal.
So in terms of, I'm Frederick Doreday, I'm in charge of global patient access from Novartis. And in terms of expected impacts, we expect the proposed project to provide a roadmap to align outcomes and methods towards building a data system that will enable health and social care system to efficiently enable initiation, maintenance, and evaluation of the right treatment to the right patient at the right time. And the first phase of the program, the stage 1, provides the important initial step, the situation analysis, so to speak, to build 80 relevant real-world data sets so that we can ensure that the work proposed in the second stage of phase 2 will be realistic in scope, relevant to stakeholder needs, and will be complementary to ongoing IMI2 and other EU collaboration for better patient outcomes from an early stage of the Alzheimer's disease progression. And turning to the next slide, the suggested architecture is to support a strategy to really translate this relevant project output into a regulatory, a clinical, healthcare, and social care practice at the end of phase 1, so that we can inform the second phase of growth. And in your proposal, please take into consideration the industry contribution and understand that some of the work package 1, 5, 6, and 7 will be fully defined in collaboration with industry partners at the full proposal stage. This will help us to optimally coordinate the forthcoming big data for better outcome CSA, the coordination and support action program. Just a few words on the CSA. This is a platform to establish and enable quality and consistency of the individual projects within the big data for better outcome. And the role of the CSA will be to coordinate, offer general advice, provide links to deep expertise when needed, and disseminate integrated findings and learnings across projects. So the CSA will be really around to act as a center of excellence to exchange knowledge and learning across projects, disseminate and share aggregate learnings, but also develop standards and guidance for the use of human samples and data in context of privacy and related legal aspects. So again, all these aspects will be relied upon from the CSA perspective. So if we go to the next slide, your expected contribution from an applicant perspective is really to align on relevant outcomes across stakeholders. We mean by that, can you bring together different stakeholders, patients, organization, clinical practice, regulatory, health technology assessment, and payers. And for that, we need expertise on real-world evidence in Alzheimer-related research and extraction methods for real-world evidence. For instance, data from hospitals, practices, care in the community, financial information, as well as imaging, information from portable devices, social networks, and crowdsourcing, again in relation to real-world evidence in the field of Alzheimer. Also, we've been interested from applicants to provide data analysis of existing data sets and combining clinical and real-world data sources, and demonstrate an ability to map digital solution, create data warehouses, and data integration tool. So these are the crunch of what we're looking for. But on top of it, in addition to, we'll also be looking for more standard input around literature review and technical writing, development of online search tool, and project management. So now turning to the contribution from FPM members' perspective, what you can expect is a provision of existing literature review, retrospective analysis, and real-world evidence, or as real-world evidence support out of existing clinical trial. And all the database integration has been done within FPM members. Patient journey, treatment options, and outcome that could be measured. But we also can provide modeling expertise. All the available models that have been developed over the last years, clinical trial expertise on intermediate instruments measures, as well as transformation algorithms, available statistics functions, and quantifying drivers of outcomes variations. The FPM members will be also providing initial assessment of potential in-house digital solution for future demonstration project, and this is more in relation to informing potential project in application in the second stage of roads. Technical and briefing book writing, that is to in support of any health economics analysis to align on relevant outcomes. For instance, when we seek to have interaction with regulatory authorities, and developing proposal and recommendation to gain HTA and regulatory acceptance, as I mentioned. And again, as mentioned earlier, there is the coordination for big data and better come from a CSA perspective and distributed data network that will be very clearly a contribution from the FPM members. And what's in it for you is really from the patient organization the ability to define a minimum set of measurable patient caregiver relevant real-world outcomes in the field of Alzheimer. From a research perspective, identify best practice to facilitate caregiver patient-centered outcomes. From an SME's perspective, an outline of data strategy that enable to characterize Alzheimer across disease stage and geographies. Here we're looking at disease stages from preclinical stages all the way to institutionalization. And in terms of geographies, a minimum set of countries would be such as United Kingdom, Germany, Netherlands, Sweden, and expanding beyond those countries. In terms of regulatory HTA payer, it's really about developing recommendation on appropriate AD-related cognitive, functional, and behavioral endpoints for real-world evidence programs, so that when innovative treatments will come to play in real life and be made available in the markets, there will be a kind of a setup available to actually reception the necessary data to inform treatment and access. And now moving on to the key deliverables. We would like to define, therefore, a set of real-world outcomes to AD relevant to both patients and caregivers. We would like to deliver searchable web catalogs of available data, and that is pretty much building on existing platforms such as IMI2, where we would be building on their experience from such platform as IMI2 in data protection, but expanding data sources beyond AD biomarkers into the real-world evidence outcome setting. We want to deliver the evaluation of suitability in combined data sources for use in natural history of effectiveness research. And again, here what we end up with is a recommendation of appropriate AD-related real-world outcome measures that reflect data needs of patients, payers, and providers beyond the traditional randomized clinical trial endpoints. We want integration of strategy of multiple data sources and new electronic endpoints, such as digital and mobile health solution option across clinical and pharmacoeconomic outcomes that we can align with payers and the health technology assessment guidelines and their expectations. And moving on to deliverable number 5, we need to articulate how digital alternatives such as mobile health applications can play a role in improving the patient care pathway, and potentially including a demonstration project. That demonstration project would be more like a proposal for phase 2 or the stage 2 implementation of roads. Qualification of drivers of validation and heterogeneity for relevant outcomes. Again, informing endpoints to drive cost-effectiveness modeling across the spectrum of the disease. Translation algorithm of existing cognitive and functional assessment across the disease spectrum to enable comparisons of results in different stages of the disease and across the different population. And on the next slide, set of statistical function connecting intermediate instruments measures to predict late-stage endpoint from variation in early-stage measures. So essentially what we're looking for is the know-how, the statistical know-how backed by the real-world evidence data to connect preclinical and early cognitive decline to a functional decline and to capacity or dependence decline. So, for instance, how do we link CDR sum of boxes to ADAS-COG with MMSE, and how this is informing quality of life and resource impact at later stage. And last but not least, the publication on model archetypes that characterize the patient journey across the spectrum of the disease using existing data source so that we can compare methodologies such as time to event, Markov modeling, linear regression, and mixed model repeat measure. Again, just an important point that we need to cover the patient population from very early stage, preclinical, all the way to Alzheimer, institutionalization, and that's me.
Thank you very much, Frederick. Now it is time for questions and answers. So this is a great opportunity that all webinar participants will have to ask Frederick, Christine, or Robin Thompson as well for any clarification or details about this topic. We also have Colin Carroll from the IMI office here available to answer your questions in case you have any queries about the way IMI works or what would be the conditions for your application. So quickly reminding you how to ask a question. You can send in your question in writing using the chat function or the question function, or you can also ask it over the phone. If you want to ask a question over the phone, you just need to use the yellow hand button. We'll take your questions on the first come, first served basis, and we will unmute you. So maybe we can leave a couple of seconds for people to organize their thoughts and see if there's anything they want to ask. In the meantime, Frederick, Christine, and Robin, you're all unmuted, so you're able to all jump in and answer. It's probably a good opportunity also to remind you that this Thursday we are going to have a webinar on rules and procedures of IMI, as Colin has announced before. So in case you're interested in participating, please go onto the IMI website. There is a link on the home page to get to the webinar page, and it's the same page anyway that I will send you a link to later on. You will all receive an email with the presentation link from today's presentation on the topic, and also potential applicants will receive the contact details of other fellow webinar participants that have participated in the webinar of today. If you want to ask any questions, this is the maybe Frederick, Christine, or Robin, is there anything else you would like to add or to pass on the message to potential applicants? Because we have no questions coming in for the moment, which means probably that your presentations are very detailed and exhaustive. So I don't know if there's anything you would like to add or let them know.
I would just add, I mean, obviously the full proposal or the call for proposals is available online, and so if people have time after this seminar to read in more details and have questions, I believe Cole, maybe you can speak to this, but there is a way to ask questions even outside of this seminar today. So I'd encourage you to go and have a deeper look and think about how you could engage within your organization and between organizations in order to make this work. But we're very excited about the possibility and the impact that this type of project could have. So we hope that the lack of questions is because people are just excited and want to get started. But certainly if after you've had a read through in more detail and have additional questions, please reach out and we will get those answered for you.
Yes, so this is Colin from IMI. So just to add, if you do have questions, please direct them to infodesk@imi.europa.eu. There's also a link on our homepage to that, and those questions will filter through to me, and if necessary, I will refer them to the topic writers and reply to you. It's important that the questions are addressed through the IMI office and not directly to any contacts in the companies. And this is to make sure that we are give a fair response to everybody who has a question.
Okay, everyone. As I see that we don't have any other queries coming in, maybe it means that it was great, and we hope that we will hear from you soon. Please do send us an email, as Colin said, to infodesk@imi.europa.eu, and it will be our pleasure to help you and answer the question as well as we can. So thank you very much to all the speakers, Frederic, Christine, Robin, and all the other colleagues in the FPA consortium for participating. Thank you, Colin, for your time, and thank you to all the participants for being online today. Do not hesitate to contact us if you have any questions in the following months, in the next month, and the best of luck for the preparation of hopefully great submissions. Thank you very much, and goodbye.
Thank you.
Bye.